graduation day ready to change the world through health promotion. I'd say on a scale of 1 to 100, I was pretty naive and even more optimistic. I was hired to work in a diabetes prevention campaign in the Edmonton inner city. I was to hand out pedometers and encourage people to eat well and be active. But how do you ask somebody who doesn't have a choice to choose better when faced with food insecurity, inadequate housing, and mental health and addictions issues? Choosing to eat well and be active becomes really hard. It is a privilege to use the word choice. So what does health have to do with poverty reduction? Well, poverty is the principal driver of poor health. Living in poverty means less choice and access to the things that keep us well, like transportation choice, adequate housing, and good nutrition. Health declines, and so do opportunities for education and employment, and that further feeds the poverty cycle. The Vancouver Area Neighborhood Deprivation Index shows us that health inequities parallel socioeconomic inequities, meaning that as poverty increases, so does the likelihood of becoming seriously injured and suffering from mental health and chronic disease. So the likelihood of these things increases, but so does the likelihood of death from these conditions. It's not just about material deprivation though, it's also about feelings of stress and disempowerment. And the White House study shows us this, in that even with adequate employment, lower income earners are more likely to smoke, more likely to get cancer, even if they smoke the same amount as someone better off, and they're more likely to die as a result of their cancer. And what about some of our more vulnerable citizens? Children living in persistent poverty have poor health and learning outcomes. They do less well in school because they're hungry. They tend to attain lower levels of education and are more likely to live in poverty as adults. We need to do better for them because there are studies that link a person's early economic circumstances with the health of their cells, meaning that poverty has a direct impact on the structure of DNA. It's called epigenetics. Additional molecules are attached onto the DNA when the body is stressed, and those molecules are super hard to get off. And they affect the way genes are expressed, putting a person at risk before they are even born. That is pretty unfair. So we really can't have a meaningful conversation about health without addressing poverty, to make sure the playing field is level and that we all have the same ability to play. This forum and strategy are an awesome start. By focusing on the areas of transportation, housing, income, and supports, we're focusing our efforts where collectively we have the biggest impact. At Fraser Health, our values of caring, trust, and respect foster a culture of support for at-risk individuals and lead to the creation of innovative, evidence-based solutions. We aim to infuse health equity across all of our programs and promote partnerships that promote healthier communities. Our environmental health officers address poverty through the built environment by advocating that health is considered in official community plans, by promoting walkable communities with good access to transit, and by asking that low-income residences aren't subjected unfairly to high levels of air pollution and noise. We sit on the Transportation Alternatives for Surrey City Centre working group, a group of community stakeholders looking at increasing active transportation, including public transit, as a viable and equitable option in Surrey. Better choice of transportation means better access to employment programs and services, and that means better health. We're working to eliminate barriers for the homeless by eliminating the need for home address requirements in our programs, by hiring outreach workers and linking them to local shelters, and by promoting guidelines for those living with concurrent disorders to their care providers. We're also working on a number of initiatives in the area of income equality with associations like the Public Health Association of BC, the BC Healthy Living Alliance, a Living Wage for Families Network, to name a few. This kind of work is really important in lifting people out of poverty. We're also supporting the health of at-risk mothers and their babies through our baby-friendly programs, Best Beginnings, and Nurse Family Partnerships. We're active in schools through our early childhood screening, immunizations, and we're working in partnership on creating comprehensive school health strategies to improve the health and learning outcomes of children in our region. And our youth clinics offer free, confidential services to youth in a safe and non-judgmental environment. Mental health conditions and poverty and substance misuse are consequences of poverty and ill health that actually work to worsen poverty and ill health. So we aim to influence this poverty cycle through our harm reduction programming and our mental health and addictions programs and services. We're lucky to live in a wonderfully diverse community, but we know that recent immigrants to Canada are at a high risk of living in poverty. Diversity Services offers translation and interpretation services and training, support, and education in a culturally sensitive manner. Aboriginal Health successfully works with First Nations communities on child and maternal health, mental health and addictions, and chronic disease. So we've got it all figured out, right? Not by a long shot. Are we committed to working on these challenges? Absolutely. We struggle to meet the needs of our clients with these barriers every day, but our commitment to these issues are built right into the strategic imperatives that guide the work of our organization. One of our high priority initiatives is to continue to build healthy communities through progressive partnerships and community engagement. And we want to work with you to make this happen. There are many aspects that go into building a healthy, vibrant, and inclusive community, and you are leaders. I'm going too fast, actually, that's amazing. You are leaders in the creation of innovative solutions for healthier communities. And as a community partner, Fraser Health wants to provide our resources and support to furthering the poverty reduction efforts and healthier communities work in Surrey. So now, some 10 years after I graduated with my big, bold vision, I am slightly naive, but I am still wildly optimistic, and I will tell you that that is a nice place to be. I'd still like to change the world, only now I know that I don't have to do it alone, and that there are committed, passionate professionals right in this community that are ready to put health at the heart of the poverty reduction conversation. Poverty is a bully that we can't ignore, but together we can do this.